I'm student nurse Alyssa, and I'm going to be doing a postpartum assessment today. I've already performed hand hygiene, so I'm going to go ahead and introduce myself to my patient. This is Elle. Hi, Elle. I'm student nurse Alyssa, and I'm going to be doing a postpartum assessment today. I would begin by asking her questions to assess her emotional status. So things like, how are you doing today? How's the baby? Is he feeding all right? Have you named him yet? Things like that. I would then begin taking her vital signs. So I'm going to check her heart rate and her respiration. So heart rate should be 60 to 100, respiration should be 12 to 20. Her blood pressure should be about 120 over 80 unless she's preeclamptic. Next, I want to ask her if she's having any pain in general, where the pain is, what the pain feels like, scale of 1 to 10, things like that. Next, I'm going to be listening to her lung fields and her heart, and I've already cleaned my stethoscope. Okay, so just listening to the 5 areas for the heart, so the aortic, the pulmonic, second pulmonic, tricuspid, and mitral. Okay, then we're going to listen to the respirations and the lung fields, make sure there aren't any adventitious sounds. Okay, I'm going to go ahead and listen to her bowel sounds, and I expect them to be active as well, about 5 to 30 per minute, and I would start in the right lower quadrant. I would then have my patient sit up so I can listen to the lung fields in the back, and also to get the CVA tenderness assessment. So for that, I would just place my hand on Elle's back like this, hit with my fist, and ask, do you have any tenderness? And the other side, do you have any tenderness? And that should give me my answer, and we don't expect any tenderness to be there. Next is the actual postpartum assessment. So we'll start with breasts. I can go ahead and ask Elle things like, how's the baby feeding? Do you notice any pain whenever you're breastfeeding? Have you noticed any breaking skin on your nipples or cracks? And I would also be assessing if her breasts are full or soft. I would expect them to be soft the first day of delivery. 3 to 4 days later, they should start to fill. Next is the uterus. So I would place one hand on the symphysis and the other on the umbilicus, and I would just be palpating for the uterus. It should be firm, and if it's soft, that's termed boggy, and it could be because of a clot. So because of that, we're going to be watching for lochia. The lochia, we should watch for the amount, the color, the consistency, and if there's an odor. I would go ahead and have Elle turn to her side so I can check and make sure there isn't any lochia that she's laying on. While she's there, I would also be checking her episiotomy for any redness, edema, any ecchymosis, discharge, and for approximation. And I would have her turn around, and the same for any other incision she may have had, such as C-section. Let's see. Next is bowel, but we already did that. We did bowel. Next is bladder. So whenever I was palpating for the uterus, I could have assessed how her bladder, if it was full or if it was empty. If it were full, the uterus would have been above the umbilicus and deviated to the right. I want to ask Elle things like, have you voided today? Did you go in the hat so that I can assess the amount? Have you had any trouble urinating? We just want to make sure that she is able to regain feeling of the sphincters and that she is voiding appropriately. Next is lochia. We already sort of did that one. So next is Hallman's sign. So I would be assessing the calves that my patient doesn't have. We'll say this is the calf. So I would be feeling for tenderness and any warmth on the legs. Okay. I would also be checking for any edema, so just palpating the legs, seeing if there's any edema. Okay, and while I'm here, I'm going to assess her reflexes. So I would bend her leg, have it relax, and then I would put my hand below the knee in the notch, hit, and wait for a reflex. Leave it flexed, and then I would assess for any clonus. So I would dorsiflex her foot, and no clonus there. Next is emotions, which we've been kind of able to assess throughout the visit. But I can just observe things like eye contact. I can ask her, have you held the baby? How are you feeling about the baby? And see how she reacts to the family's reaction to the baby. Let's see, next I want to assess for the skin changes of pregnancy. So cloasma, the mask of pregnancy, so right here. We want to assess for linea nigra, which would be on her stomach. We want to assess for any striae, so that could be on her stomach or on her thigh leg area. And those can be pink, silver, reddish, white, depending on the person. Then we also want to ask, have you been perspiring a lot? Maybe at night? Have you noticed that your sheets are damp when you wake up? Things like that, to know that she is successfully eliminating any extra fluids. Next, we want to talk to her about her activity levels. So just and diet, and we want to make sure that you drink a lot of fluids. You want to add at least 200 to 300 more calories to your diet to compensate for milk production. Don't lift anything heavier than your baby, and that should be a good guide for you throughout your recovery. Let's see, let me make sure I don't forget anything. And with her reflexes, we should expect it to be 2+ and normal. And then lastly, we just want to say things like, if you ever feel as if you can't do this, if you feel too tired to take care of the baby, there are plenty of resources that we can help you out with, so just give us a call, okay? And that would conclude our assessment. So thank you, Elle, and thank you for watching.